Well, there's no doubt that the coronavirus has impacted the mental health of millions of people. So much of our lives have been uprooted and turned upside down. And while it's not an official diagnosis, so-called COVID paranoia is very real. Next week marks Mental Illness Awareness. And here to talk about it is Dr. Laura Saunders, Assistant Director of Psychology at Hartford Healthcare's Institute of Living. Doctor, welcome back.
Thank you, Lisa.
Thank you for being here. So COVID has amplified issues for people with mental illness. How so?
So I'm getting more and more, clients talking to me about, oh, my friend can't come out because his mom has COVID paranoia, or, my friend hasn't been able to go to school because his parents have COVID paranoia. So I'm hearing this more and more often. And while it's, as we said, not an official diagnosis, there does seem to be an exacerbation, likely with people who had underlying anxiety issues, significant anxiety issues. And this whole COVID situation has exacerbated that. So my concern is that developmentally, kids are being inhibited from leaving their house or going to school, even if it's a hybrid model, up to the guidelines that the state's currently issuing.
So go into more depth on what is COVID paranoia. Is it just with kids' play dates, or does it go into other parts of people's lives?
I think it's going into all aspects of their lives, not just the children, but likely the entire families themselves. There's times where there's a medical condition in the family and kids need to be far more cautious, but what we're seeing with more and more individuals, and everyone that I've talked to knows someone like this with this COVID paranoia, where they're just not taking the steps that the state's allowing them to take, and acting as if it's still March, where it's stay home and isolate.
Gotcha. Okay, how could this be distinguished from general anxiety?
Well, I think it's being exacerbated or brought on by the whole COVID pandemic. So because the initial guidelines in the COVID pandemic were to kind of isolate more, I think people are isolating. So it's probably going to build up on social anxiety. It's going to build up on more generalized anxiety. And so, for young children, or really all children, teens as well, to not get out of the house and not be able to meet some of their developmental milestones and have academic stimulation can really be damaging long term.
All right, talk about what parents should be watching out for in their children in these times.
Well, I think that, kids who have underlying anxiety can pick up on this too. And I think in part it was because in the spring, a lot of the guidelines were consistently changing. We'd be issued a guideline and then it would get curtailed. So, I understand how this could have gotten exacerbated, but, kids who are taking on undue anxiety, it's going to affect them. They may isolate more. They may have more fears. It may affect their sleep. It may affect other things. So, the more we can really address these issues and label them, I always think that's important to identify and label them, the better it is.
I know sometimes it's harder than other times to put on a brave face for the kids, but we have to. Where can people go for help, Dr. Saunders, if they think they need just something?
So, I always say to check with your pediatrician, your school resource folks. They have lots of support there. So check with your providers, and they can help you get connected if this is a more serious problem.
Okay, and as you see on the screen, instituteofliving.org. Dr. Laura Saunders, thank you so much for joining us. Always great insight.